your source for information about your hometown and surrounding area. Tiger Talk is brought to you by Tiger Talk, brought to you by String Beans Coffee House on Lower Main in Princeton, Hancock's Neighborhood Market on Commerce Street in Katie's Delicious Homemade Goodness, and Perry's Floors and More. String Beans Coffee House in downtown Princeton specializes in made-to-order espresso drinks. Stop by Monday through Friday from 7 a.m. to noon and enjoy a pick-me-up. You can also enjoy fresh-baked scones, homemade chocolate chip and oatmeal raisin cookies, and espresso brownies that'll keep you going all day long. They're also open on Saturday from 9 to 2. String Beans Coffee House on Lower Main in Princeton. Great coffee and more in a great atmosphere on Lower Main in downtown Princeton. And good Monday morning. Welcome to Tiger Talk here on your hometown radio station, WPKY. It's 6 minutes past the hour. It's Monday, and I have the pleasure of welcoming into the WPKY studios Dana Southard, and she is the nursing administrator at the Pennyrile District Health Department. Good morning.
Good morning, Ty. How are you?
I'm just wonderful. Fine and dandy. So glad to see you. I was telling you how hard it is sometimes to schedule Monday shows, so I'm so glad you're here. And we've got something really cool to talk about, and that is the Cribs for Kids program. That's an initiative out of the health department. And why don't we start and you give us a little background on what this is all about, and we'll go from there.
All right. The Cribs for Kids program is part of the MCH, which stands for Maternal Child Health Block Grant. Most of the counties in Kentucky, I would say, get some funding for this initiative. What it is there is specific money set aside that has to be used to prevent infant deaths, to help educate as far as good prenatal care, and also to help with the childhood obesity. All that rolls into that. At the health department, we have 4 or 5 different packages that we're working on. One of them is the Cribs for Kids program, which we're going to talk about. Another is prevention of abusive head trauma. We have a coordinated school health program, which I'm working with the FFA on some of that. And we also have the Healthy Communities Active People, which kind of encompasses a lot of stuff.
And that's there to fight the obesity and potential childhood obesity issues that are so prominent.
Yes.
Okay.
But with the Cribs for Kids program, what that is, it is a community partnership where I don't want to have to say necessarily that I have to go out and beg for money, but what you're looking is to build these partnerships to help raise awareness.
Right.
And provide more education. And with that, it's a 50-50 match grant. And what that means is if WPKY agrees to purchase 5 cribs, then the health department can come in and buy 5 cribs. So in that way, we're able to provide 10 cribs to needy families.
Right. And, of course, these cribs are all state-of-the-art, up-to-date. There are certain standards that these cribs have to have to put your child into it. I mean, these are, and what we're talking about here is that, there are incidences of infant death, whether it's SIDS, whether it's other types of infant death, and these cribs are a surefire, safe way to lay your kid down and have at least good peace of mind. Doesn't necessarily mean something can't happen, but this is all about the education of a newborn, right? Of allowing, how to properly put your child down in the evenings, I guess.
Correct. And when we say crib, it's actually a pack and play, because what we're looking for is a safe sleep environment.
Oh, yes.
Because what's been found is about 90% of SIDS deaths there's been an unsafe sleep factor attributed to that.
Okay.
And whether that's stuffed animals in the bed, cover in the bed, there's also a principle of this, which is ABCs.
Right.
Put your baby down alone, on their back, and in a crib. So you want a firm sleep service where you can't sink down in it.
And that's nice to have an acronym like that.
It is, because
really
that one's
is.
simple.
Yes.
Alone, back, crib.
Wow. Yeah, and it is important that people are educated on this, because every once in a while, you hear a news story where there's a tragedy. Somebody has maybe fallen asleep with their newborn, and you have a tragic situation occur. This is a way that someone from the health department, I believe J.T. Powell, does a lot of this education out of the health department. Is that correct?
She does. JT and the HANDS program, Kathy Jo Sample, they help distribute the cribs and provide safe sleep education. I mean, the easiest way if a family needs a crib is to be part of the HANDS program.
All right. Tell us a little bit more about that, and then how someone might get involved and be a part of the HANDS program.
The HANDS program is run through the health department. You do not have to be a patient or a client of the health department to be part of the HANDS program. Any first-time parent can be part of it. I really wish that I'd have known about it whenever I was pregnant. But it's a home-based where they come into your home. During your pregnancy, they just help give you some information of what to expect as you move along during the pregnancy, to help you with the items that you may need to get ready for the baby. They go over baby proofing. They go over, after the baby comes, meeting those developmental milestones. Just, they help you know what to expect. They work with you in order to, they make your baby smarter.
Right.
Actually, they'll teach you games and different interactions to do with the baby.
Right.
And if, and like I said, if there's a need, they can help provide a crib and provide the education that goes with that.
Awesome. So we're talking about several things here, but one of the main things with the cribs for kids is, of course, JT and Kathy Jo. They're their HANDS program. They're within the health department, so they will basically come out and do these trainings into the home, I guess, for first-time parents.
Yes.
But also that will be basically the contact for the cribs if someone is in need of a crib that we're talking about that is part of this program, which is Kids for Cribs. Now, this information that you provided me, of course, you are looking for community partners to make donations to you to match so you can get the cribs, correct?
Yes.
Yes.
Because, like I said, we have funds available, but I have to have the community partners in order to utilize that money.
Right. And I know you said you sent out some letters to about 60.
About 60 people.
Okay.
Right now, I've just focused in Caldwell County. I'm hoping to spread out to some of the other counties in my district.
This is district-wide.
It is. And I've received feedback from about 4 or 5. And I'm going to go ahead and tell you who they are, because I said I would give a shout-out to them.
Yeah, let's do it.
Jake Pepper at Planters Bank was the first one.
Awesome.
Tiffany Massey from Farmers Bank got a hold of me, and they got 2 cribs.
Okay.
We have Polly Eyes Pizza, Morgan's Funeral Home, and then one of my first out-of-county ones was Lola Baptist Church in Livingston County.
Awesome.
So,
well, good deal. If you're out there listening and you want to help out with this, what a great program it is. All you have to do is be willing to match it. These cribs are about $100 each, aren't
about $100. You get a pack and play. You get a crib sheet. You get a sleep sack. What a sleep sack is, it's kind of like a onesie.
Right.
Yeah. Where you're not putting them in blankets.
Right.
That's the main thing. They don't need anything.
Well, I
think
a sleep sack would be a good idea for me.
Until you had to get up and go to the bathroom and fell down.
Might have to hop, right?
Yep. And then you get several educational, you get videos and information with that.
Yeah,
so,
it's a really neat program here. I mean, you've got a list here on your correspondence as to what at least $100 donation will provide at least one crib, and then so basically you buy one crib, you match one crib. You buy 5, there's 5 cribs there.
Right.
So the more you can do, the merrier, so to speak. But that's fantastic. And of course, we do want to say that it is tax deductible.
Yes.
the donation is. And also, those of you that are sitting there going, I'd like to do that, you'll be recognized for doing so. I think Dana and the health department will have something in the paper, and of course we will run thank yous here on WPKY for that. So if you're out there listening and you have not been contacted and it's something that interests you, this is a good program, and it will affect can affect lots of folks here in the county, and we know that it can keep babies safe and get parents off to the right start with their baby.
Yes.
So, okay. Anything else that we did not mention about this program or about how somebody might go about doing this? Because I guess you already have. Is this something that they can immediately start applying for and go through the HANDS program?
Yes.
Okay.
Yeah, they can, because we already do have some cribs.
I figured you probably did, yes.
Because, like, this program's been around
it's been around, yes.
for years. It's just this is where I have time right now to put my focus.
And we need to focus on it, remind people that it's there.
Right. One thing I do want to say is just the statistics
yes.
of SIDS.
Let's talk about that.
In the United States, 1 in 7 deaths occur unexpectedly during sleep. And in Kentucky, that number is 1 in 5.
Yeah.
So, like everything else, we're leading the nation in bad stuff.
Right,
so,
right.
But
a lot of that's, I think, education, isn't it?
It is, because there's so many things. Back in the mid-'90s, there was that huge initiative of back to sleep, sleep. And we've kind of gotten away from it. I don't hear about it quite as much. Right. I mean, of course, in the health department.
You just get complacent. You think, oh, everybody knows that now.
Right.
But not necessarily.
Right. Until you have to think about all of your grandparents and great-grandparents who are raising babies. And back then, you put the baby on the belly.
On the belly, yeah, that's right.
So it is education and just those safety factors.
It certainly is. So, for your donation, you provide a Graco pack and play sheet with a safe sleep message, a Soothie pacifier, a Sleep Baby Safe Snuggie, that's a children's book, a Halo sleep sack. I love the sleep sack. ABC's a safe sleep little magnet, a DVD, and and more educational material. So that's fantastic. You already got at least 5 or 6, you say?
Yes.
And if you're out there listening, how do they contact you if they're going, man, I want to be part of this? What do they do?
They can just give me a call at the Caldwell County Health Department. It's 270-365-6571, and they can ask to speak with me, and I can get them took care of.
That is awesome. Okay, so really, and let's don't talk necessarily dollar amounts. Let's just talk about I'll do a crib for this, and it's like I said, it's about $100. So
it is.
You might do 1 crib, may do 5, may do 10 cribs, but that'll just be up to you. But know what if you do 1, they'll do 1. If you do 5, they'll do 5, and it's basically a 50-50 match.
Right.
So that's awesome. And this is a continuing thing.
It is. It's ongoing.
It's ongoing. So if you have not received one of these packets from Dana, a letter, and soliciting you for this, then give Dana, I'm sorry, I want to say that, Dana a call, 270-365-6571. You can also email her at danaj.southard, that's SOUTHARD, at ky.gov as well if you're interested in helping out with this great program. It's the Kentucky Kids for Cribs program, and it's good stuff.
Yes.
It certainly is. So, and again, this is an ongoing initiative. If you would like to help, then give Dana a call, 365-6571 at our health department. Anything else?
Not that I can think of.
Okay. Go ahead.
One thing, if you haven't got your hepatitis A vaccine,
yes,
come to the health department and we can take care of you.
And let's talk about that for a minute. We are running the commercials on that. This is a new requirement and let's talk about the ages again. There's a 2-dose type thing that they need to get. There'll be something and a booster, right? The original and a booster?
There is. The hepatitis A is a 2-shot series.
It's a series, yes.
Typically, we give it at age 12 months, but the laws have changed. So if you're 18 years old, you still need to get your hepatitis A if you're in school. I recommend adults get it too because the state of Kentucky is in a Hep A outbreak.
Right. I've noticed that. You see it more in the news stories, and it's a simple vaccine. It's like a flu shot. You just get a little shot, and boom, you're done.
Right.
Yeah. What do they if somebody comes to the health department What do those run? I mean, how's that work? It just depends if you ever have
It does. Most of the time, it's going to be covered by insurance.
insurance. That's what I was going to ask. Yeah, most of it is covered by insurance. isn't it?
Because especially now that it falls under that preventative.
I wondered if it was a preventative type deal. Yeah.
So if a child does not have insurance, it's still covered at a discounted
At a
rate.
discounted rate. Okay.
So
And then the other one is the meningitis
yes,
deal.
yes, they've Kentucky has also passed a law where all 16 to, if you're still in school,
Right.
you're going to need a booster dose of the meningitis vaccine.
Right.
And a lot of colleges have already made that second dose
Exactly. Yes.
mandatory. So it's
And it's good to get.
It is. I honestly think that's probably one of the most important because, I mean, even though meningitis is very rare, I mean, it can kill you in 24 hours.
Sure.
So
Sure. Yeah, so get those, and of course you'll hear the ads from the Pennyrile District Health Department that we're running concerning those. But if you fall into those categories, then you might want to contact your health department or your medical provider,
yes,
and they can get that worked out for you.
yes,
So, well, thank you so much for being here.
you're welcome. Thank you for having
Certainly
me.
appreciate that. Again, get in touch with Dana Southard at the Pennyrile District Health Department. She is the nursing administrator. If you're interested in anything you've heard about the Cribs for Kids, if you want to be a community partner, they need community partners to help with this fantastic program. 365-6571 is the number to call. Thank you so much for being here today.
Thank you. It's always a pleasure.
All right. That is Dana Southard. She is, again, the nursing administrator for the Pennyrile District Health Department and serving all the Pennyrile District Health Departments. And what are those counties again, Dana?
Caldwell, Crittenden, Livingston, Lyon, and Trigg.
There we go. All right, and we certainly appreciate her being our guest this morning on Tiger Talk at 8:21. We also invite you back at 8 o'clock and each and every morning here, Monday through Thursday on the Tiger for Tiger Talk at 8 o'clock. My thanks to Dana Southard, and we bid you a good day, and tune in tomorrow at 8 o'clock for Tiger Talk here on your hometown radio station, WPKY The Tiger. Hancock's Neighborhood Market on Commerce Street in Cadiz is the place to shop for delicious homemade goodness.